Samidin, DNS 07210070. I would like to present about definition of amputation disease. Amputation disease is the removal by surgery of a limb or the other body part because of injury or disease such as diabetes or cancer. Removal of part or all of a body part that is enclosed by skin. Amputation can occur at an accident site, the scene of animal attack, or a battlefield. You may need an amputation if you are undergone a severe injury or infection, or have a health condition like peripheral arterial disease. Amputation is also performed as a surgical procedure. It is typically performed to prevent the spread of gangrene as a complication of frostbite injury, diabetes, and arteriosclerosis, or any other illness that impairs blood circulation. It is also performed to prevent the spread of bone cancer and to curtail loss of blood and infection in the person who has suffered severe irreparable damage to a limb.
Assalamualaikum, my name is Hani Shafika binti Masin. My metric number is DNS 07210009. Now I will present about anatomy of amputation, which is the first anatomy is the normal patients foot before amputation surgery. The second anatomy is amputation line for the transtibial armpit showing residual anatomy points of pressure over soft tissue. The bone protrusions include tibial and fibula epicondyle. Head of the tibia, distal amputation line for the tibia and fibula not in red points. For related to injury which is open, guillotine, to perform when infection is present and wound remains open to drain. When infection heals, surgery is performed to close the wound.
The next is etiology. The causes for amputation may include any of the following: disease such as blood vessel disease, called peripheral vascular disease or PVD, diabetes, blood clots or osteomyelitis, and infection in the bones. Injuries, especially of the arms, 70% of upper extremity amputation are related to trauma.
Assalamualaikum, my name is Nusafira Karina binti Nini. My matrix number is DNS 07210058. So I will continue pathophysiology for amputation. First is diabetic ulcer. Diabetic ulcer that cause limb amputate. Limb amputate happen because to prevent the spread of infection in wound that heal slowly. The second one is tumor. Removal or amputation of the tumor occurs to save the organ and the limbs. Third is patient who smoke. In cigarette has contained the nicotine. That nicotine can increase in the level of platelet adhesion. Also will increase the risk of thrombosis microvascular occlusion leading to the tissue's ischemia, resulting in blockage of peripheral arteries. Next is gangrene. This is happen because lack of blood supply. There is an infection in it. Therefore, the amputation occurs to save patient. Lastly, amputation injuries. For example, is accident or trauma. When a limb is injured badly, that recover is more effectively with amputation. That's all from me. Thank you.
Assalamualaikum, my name is Nur Farisha Izwani binti Azlan. My normometry is DNS 07210049. I would like to explain about clinical manifestation of amputation. Clinical manifestation of amputation is pain or numbness, like the sensation may be felt in the whole leg, below the knee, or on different area of the foot. Secondly, gangrene is die of body tissue due to a lack of blood flow or a severe bacterial infection. Gangrene commonly affects the arms and legs, including the toes and fingers. Next, slow or non-healing sore or wounds, those that fail to heal in the usual period of 4 weeks to 3 months. There who is heal at slow pace and tone required. After that, shiny, smooth and dry skin on the leg and foot. Shiny and smooth leg and foot caused by stretching of the skin, which make related to pulling of fluid in the lower extremities. Dry skin, leg and foot is caused by environmental factors that remove moisture from the skin. Besides that, thickening of toenails or nails is caused by fungal infection. Absent or weakened parts in the leg caused by don't receive enough blood flow to keep up with demand. Lastly, infection that won't heal. Infection may extend the length of inflammation, interrupt a wound's healing stage, or interfere with clotting. Infection and bacteria result in slower healing wound.
The next is investigation. Investigation for pre-operation is install the drop flow meter at the position where it is filled or fluid. Although there is no flow, an escape route should also be available for the second unwanted phase. The purpose is to assess blood flow to the tip. Next, attach the segmental blood pressure determination at the patient's leg and arms to assess blood flow and duct pressure at the tip. Transcutaneous partial pressure oxygen reading should also be taken to measure oxygen delivery by blood vessel to the affected part. Then investigation for post-operative is a complete blood count (CBC) must be taken to determine hemoglobin and hematocrit levels. If the complete blood count (CBC) drops sharply, it indicates bleeding. Next, measure blood serum urea electrolytes and reflect fluid balance to detect the abnormalities of blood chemistry, primarily kidney function and dehydration. Vascular droplet ultrasound is also performed if the patient is suspect of having deep vein thrombosis.
There are several medical and conservative treatments for amputated patients that nurses can give to the patient. First of all, is doing rigid dressing or soft compression. This is applied to prevent infection and minimize edema. Secondly, apply as bandage to allow cone shape to form and prevent edema. Thirdly, eat high protein, fiber, vitamin C, and drink a lot of water to balance electrolyte. For medications treatment, nurses will give IV antibiotics for pre-operation. General anesthesia acts like an agent to control blood pressure while intra-operation. For post-operation, nurses will administer antibiotics to inhibit bacterial cell replication and prevent infection. Nurse also will give local anesthetic to the nerve invasion part of amputation to help reduce pain and steroids to reduce swellings.
Assalamualaikum, my name is Nur Shafika binti Deni and my matrix number is DNS07210060. Today I will present about the surgical or operation treatment for amputation. The surgeon who performed the amputation strives to preserve as much of the person's original body as possible while removing any injured or diseased tissue that could affect the health, safety, or comfort of the patient. There are several surgical treatments for amputated patients that nurses can give before surgery. Firstly, consult patient to the amputation rehabilitation specialist for counseling process and limb preparation before surgery. Second, create a physiotherapy session for limb recovery therapy. Next, provide emotional, surgical, and economic assistance from medical welfare officer. After that, do a routine blood test on the patient. Lastly, do a radiological examination such as a chest X-ray and X-ray on the affected part. That's all from me. I will pass to the next presenter.
Assalamualaikum, my name is Nur Alina binti Zainal. My matrix number DNS07210044. Today I'm going to present about treatment of amputation for rehabilitation. Is physiology. First, teach proper breathing maintenance. Number 2, teach the patient to wrap the residual line correctly. Number 3, teach the patient correct way of positioning. Number 4, advise the patient to do balance exercise. And the last one, teach patient to use crutches. And the occupational therapy is patient will be reviewed regular by the consultants, the physiotherapist. Assalamualaikum. My name is Nur Alina binti Zainal. My matrix number is 07210044. Today I'm going to present about nursing care plan implication. Assessment, the subjective data, patient complaint that had numbness and fatigue. The objective data, weak pulse, gangrene and edema. The nursing diagnosis, impaired physical mobility related to amputation. The goal is within 24 hours of nursing intervention, patient be able to number 1 alleviate symptom and number 2 maintain healthy tissue. The nursing intervention number 1 is clean and dry thoroughly and rewrap stump with elastic bandage. The rationale to alleviate and not complication. The number 2 measure circumference periodically. The rationale is to estimate shrinkage to ensure proper fit of shock and prosthesis. Number 3, assist with specified room exercise. The rationale is to prevent contracture deformities. Number 4, encourage active exercise for unaffected limb. The rationale to increase muscle strength. Number 5, instruct patient to lie in prone position, recumbent, fowlers in every 2 hours. The rationale to prevent flexion contracture of the hip. And number last, assess patient with ambulation. The rationale to reduce potential for injury. And the evolution is after 24 hours of nursing intervention, the patient amputation symptom and can be alleviated and healthy tissue can be maintained.
Assalamualaikum. My name is Khatrul Najah binti Roslan and my number matric is DNS 07210076. I will present about complication of amputation. First, lead to additional problems such as infection and blood clots. Individuals' change of experience. These complications include their age, general health, and the type of amputation they've had. Second, emergency and planned complications. Compared to emergency amputations, planned amputations are less likely to lead to serious complications. Third, needed to treat a problem neuromas affected by a certain type of neuromas or thick nerve tissue. It could be removed, for instance.
Making an amputation bed. This bed is made to facilitate the wrapping of the stump. This bed to ensure that the stump is visible to staff moving around the ward, so that at a glance any bleeding can be observed. An amputation bed is prepared for the patient with amputation of the leg to take off the weight of the bedclothes off side of the operation with the help of a threader. An amputation bed is prepared for those who have input their limbs due to any abnormality. That type of bed is easier for patients who have had surgery. It is comfortable for such a patient, or the bed is arranged in such a way that there is less pain on the surgical part, which the patient is without any limbs. An amputation bed is a bed in which top line is divided into 2 parts to visualize the amputated part of the lower limbs without disturbing the patient.
Assalamualaikum. My name is Nur Farisha Izuri Mikti Azlan. My number matric is DNS 07120049. I would like to explain about indication of stump bandaging. Indication of stump bandaging is diabetic amputation, which need to be amputation because of reduced blood flow. Wounds may be slow to heal or not heal at all. Secondly, traumatic amputation when a person has a loss of body part, usually as the toe, arms, or leg that occurs as the result of accident or injury. Next, gangrene. Gangrene which need to amputation to restore blood flow and remove that issue. Besides that, cancer that can spread to the bone and head to amputation. After that, patient who have peripheral vascular disorder is a blood circulation disorder that causes the blood vessel outside of your heart and bring to narrow, block or spasm. This can happen in your artery or veins. Peripheral vessel disease typically causes pain and fatigue, often in your leg, especially during exercise. This disease has a potential to lose part of limb or even lose life. Lastly, neuropathy. Neuropathy is a result of damage to the nerve located outside of the brain and spinal cord.
Items that needed as preparation for patients with amputation bed is number 1, firm bed. Second, extra set of top linen to make a divided bed into 2 parts to visualize the amputated part of the lower limbs without disturbing the patients. Number 3, blankets and counterpane to provide warmth to the patient and to give a neat and tidy appearance. Number 4, bed cradle to keep the weight of the bedclothes from pressing over the part. Number 5, tourniquet and dressing tray to control hemorrhage in case of emergency.
Okay, next I want to present about step of procedure. First, we have to grade patient and introduce name, and we must tell them what we want to do. Make some privacy for patient. We close the screen. Prepare the bed as simple open bed. Make bottom half of the bed. Fold sheet crosswise at the center of the bed. At bottom tuck in and make corners. Make upper half of the bed. Next, the other side of the top linen start from the stump but overlapping the first one, and the excess is tucked under the mattress at the foot. When the patient brought back from the operation crate, fan fold 2 sets of linen one side of the bed and receive the patient on the bed. Bed crate is used to take off the weight of the linen, cover the patient and keep him warm and comfortable. The 2 sections of the top linen should overlap each other at least by 8 to 10 inch. That's all from me. Thank you.
Nurse responsibility for amputation bed for pre-operative is prepare the bed as for a simple bed to make sure that patient get a good posture for maintain the body alignment and prevent fatigue. Second, nurse must have to move any furniture away from the bed to provide undesirable and give a safe surrounding to the patient. Lastly, nurse need to educate ventilation and light.
Next, I will present about nurse responsibility during amputation bed. Firstly, nurse responsibilities for amputation bed is nurse should take care of bed hygiene to prevent the transfer of microorganisms from the source to the new host by direct or indirect contact, or prevent the multiplication of microorganisms. Next, make bed cradle. It is used to take off the weight of the top linen. Lastly, make the 2 sections of the top and it should overlap each other at least by 8 to 10 inches so that it can easily lifted to observe the stump and also to prevent unnecessary exposure of the patient. That's all from me. I will pass to the next presenter.
For nursing responsibility post-op amputation bed. First, final check of the bed is for to make sure enough equipment have been prepared and also all equipment are functioning well. Second, provide extra pillow if necessary to make patient in comfortable position and also keep stump in good position. Third, provide ripple or foam mattress. It helps to reduce pressure on the skin.
Now I will present about a summary of amputations. Amputation is a surgery to remove all or part of a limb. So patient may need an amputation if they undergone a severe injury or infection or have a health condition like peripheral arterial disease. Second, types of amputation is above knee, below knee, arm, hand, finger, foot, and toe. It can be necessary to keep an infection from spreading through the limbs and control pains. And then after amputation surgery, it will take some time to get used to moving without natural limb. And the last one is patient need to practice physical therapy exercises to build strength, balance, and mobility. That's all from me. Thank you.
Jadi stump bandaging. The purpose for bandaging a stump is to shrink and shape the stump. Proper bandaging will reduce the excessive adipose tissue and will lessen the tendency of development of an adduction wound in addition. Bandaging supports the soft tissue in the early healing phase following amputation in order to achieve stump healing after transverse amputation. Various methods are applied, such as soft dressing followed by elastic wrapping of the stump, rigid dressing, semi-rigid dressings, and more recently, the application of silicone or gel liners. A systematic literature search was performed to identify the optimal post-amputation management. The methodological quality of the studies was systematically evaluated by using a predefined list of criteria. Confirm the patients identified using at least 2 patient identifiers according to your facility's policy. Explain the procedure to the patients, perform and hygiene and put on gloves. Perform routine post-operative care, frequently assess respiratory status and level of consciousness. Monitor vital signs and IV infusions. Check tube patency and provide for the patient's comfort. Pain management and safety.
Assalamualaikum, my name is Nur Farisha Izuri Mekti Azlan. My normal matrix is DNS 07200049. I would like to explain about indication of stump bandaging. Indication of stump bandaging is diabetic amputation which need to be amputation because of reduced blood flow. Wounds may be slow to heal or not heal at all. Secondly, traumatic amputation when a person has a loss of body part, usually as the toe, arms, or leg that occurs as the result of an accident or injury. Next, gangrene. Gangrene which need to amputation to restore blood flow and remove that tissue. Besides that, cancer that can spread to the bone and head to amputation. After that, patient who have peripheral vascular disorder is a blood circulation disorder that causes the blood vessel outside of your heart and bring to narrow, block or spasm. This can happen in your artery or veins. Peripheral vessel disease typically causes pain and fatigue, often in your leg, especially during exercise. This disease has a potential to lose part of limb or even lose life. Lastly, neuropathy. Neuropathy is a result of damage to the nerve located outside of the brain and spinal cord.
Items that needed for patients with stump bandaging. Number 1, Wrap bandage size 10 cm. Elastic bandage of appropriate width and length for cover the amputation part. Second, micro-pore tape or safety pin. It is to make sure bandage keep tidy. Number 3, dressing set is an optional when needed.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nusafira Kalina Bitideni. My matrix number is 072100058. So I will continue. Step of procedure. First, greeting patient and introduce self. Second, close the screen. Third is hand washing to prevent cross-infection. Fourth, hold bandage roll facing up you and towards you. Next, hold the bandage with the dominant hand and the end of the bandage hold with the other hand. 6. Place the bandage on skin in the proximal part in a vertical way. 7. Bring bandage to posterior and anterior again up until it covers stump part. 8. Finish the wrap on the proximal side with 2 circular turns. Lastly, pin bandage with a pin or plaster at the top of the bandage. That's all for me. Thank you.
Nurse responsibility pre-operative for patient with stump bandaging is nurse must confirm the patient's identity using at least 2 patient identifiers according to your facility's policy before start the procedure. Next, nurse must explain the procedure to the patients. Patient's understanding is likely to encourage compliance and assuming the advice is sound. Patient well-being. Then, perform hand hygiene and put on gloves is very important to protect patients and to prevent the spread of microorganisms.
Next, I will present about nurse responsibility during stump bandaging. Firstly, nurse responsibilities for a patient with stump bandaging is don't place a pillow under the thigh to flex the hip because this positioning can cause hip flexion contracture. For the same reason, tell the patient to avoid prolonged sitting. Second, wrap the stump when it's elevated to prevent edema and vascular stasis. Lastly, provide analgesics as ordered by doctors in the absence of regional anesthesia. The severity of the stump pain requires management with strong opioids as a baseline. Opioids used in isolation are, however, often insufficient and required to be taken such in the quantities as to cause significant sedative side effects. Consequently, adjuvant analgesics such as IV ketamine are frequently required. That's all from me. I will pass to the next presenter.
Next, for nursing responsibilities, post-op stump bandaging. First, monitor patient stump dressing every 2 to 3 hours. Second, check the wrapping and condition of the stump. Third, elevate the leg with the pillow. 4. Monitor functioning of drainage. 5. Check the amount of blood and drainage on the dressing. 6. Serve medication as per order. 7. Taking a bath. 8. Gently wash your stump. 9. Prosthetic limb. 10. Regularly clean the socket. And lastly, check your stump carefully every day.
Assalamualaikum. My name is Nur Alina binti Zainal. My matrix number is 07210044. Today I am going to present about summary stump bandaging. Number 1, stump wrapping is for the shrinkage and formation of stump. Number 2, proper bandage can also reduce excess adipose tissue. Number 3, there are types of amputation. The amputation of a limb due to an accident and injury. Number 4, among the equipment used is a 10 cm clip for the amputation, but a micro-pore tape is also needed for safety so that the bandaging is always needs. Number 5, steps of stump bandaging are to review the patient document so that the correct plan can be made for the patient. Explain the procedure to the patient. Effective hand washing. Number 6, the nurse responsibility. Performing the procedure is to identify the correct patient, give Advice: wear glove. Number 7. The nurse responsibility during the procedure is to not place a pillow under the as this may cause infections. And number 8. The nurse responsibility after the procedure is to monitor the stump rising every 2 or through till 3 days, especially checking skin color and bleeding.